I'm Mrs. Andrews. I live in Bramble Lodge Care Home. I'm getting very forgetful these days. I can't quite remember how long I've been here. I miss Arthur, my husband, terribly since he died. I would never have chosen to live in a home, but the staff here are wonderful. Especially Jackie. She looks after me so well. She can probably tell you more about how I got here. Jackie, come over here and tell them all about it.
Of course, Mrs. Andrews. Anything for you. Hello, my name is Jackie. I'm a care assistant and Mrs. Andrews' key worker. She initially came here for respite after a number of falls. Sadly, Arthur died shortly after she arrived, and it became clear that she wouldn't be able to go home as there were no other family members to support her. We do a detailed assessment on all our residents at the point of admission. We found that she was very muddled. She was a bit agitated, and at times she could shout at staff in a very aggressive way. I wasn't sure whether she had dementia or whether it was delirium. We'd learned about delirium at our local care home forum. She'd had her medications reviewed during a recent hospital admission, but she was still taking 5 separate drugs. I wondered if there might be something there that could be contributing to her confusion. There's been a lot of work done in our area to make healthcare professionals more accessible to care home staff. I called the dementia outreach team and also contacted Dr. Smith, our allocated GP, to let her know that Mrs. Andrews would need a medical assessment as she would be staying long term. I also called Karen, our local care home pharmacist, to see if she could look at Mrs. Andrews' drugs. She's been doing a quality improvement project to help with prescriptions.
Hello, my name is Karen. I'm a community-based care home pharmacist. Recently, I was involved in a quality improvement collaborative focused on care homes. It gave me the opportunity to develop a direct referral pathway that enables care home staff to contact me when a new resident arrives. When I came to see Mrs. Andrews, the staff at Bramble Lodge asked me whether her medicines were contributing to confusion. She was certainly very muddled and was taking several medications, which might be making this worse. I stopped an incontinence medication that she was taking immediately. I was less certain about her blood pressure medications. These might have been adding to her falls risk. I made a note to raise this with Dr. Smith at our next virtual ward round. She was also seen by Susan from the dementia outreach team a couple of days after I visited.
Hi, I'm Susan. I am a community psychiatric nurse working with the dementia outreach team. We received a direct referral from Bramble Lodge when Mrs. Andrews arrived. By the time we got to her, the staff at Bramble Lodge had already started completing an ABC chart with detailed records of her behaviors, how these were affecting her and those around her, and whether anything in particular seemed to be triggering them. She was becoming quite agitated and aggressive during washing and dressing, but was very drowsy and sleepy at other times of the day. There was no real pattern to it, and I wondered whether she might have an element of delirium. The staff at Bramble Lodge are really good, and they had already been trying different approaches to washing and dressing. We planned to come back in a couple of weeks to review progress. I wrote a letter to Dr. Smith to highlight our concerns about delirium.
I'm Dr. Smith. I was asked to take over Mrs. Andrews' care after she arrived at Bramble Lodge. In preparation for our multidisciplinary virtual ward round, I read through notes from her recent hospital admissions. She'd been in and out like a yo-yo, and it seemed as if there was a real lack of continuity that had left some loose ends around her medicines and falls. When Karen told me she had stopped Mrs. Andrews' continence medication, I was quite relieved. She asked about the antihypertensives, and I wasn't so sure. We decided that we would also request a falls specialist review because of her falls history. I also had a note from the dementia outreach team asking about the possibility of delirium, so we decided that I would go and see Mrs. Andrews as a priority. At the home, I assessed Mrs. Andrews using the confusion assessment method, which supported a diagnosis of delirium. She had a slightly low blood pressure, and I stopped her blood pressure medicines. I also took routine blood tests to look for a cause of confusion. One of these suggested she was hypothyroid, and I started her on some treatment for this.
After Mrs. Andrews had been seen by the other members of the multidisciplinary team, her confusion slowly got better. The falls team came and we looked together at her routine and how we could reduce her risk of falls. Her old walker didn't suit her anymore and a better one was organised. Once the delirium was treated, she was much less confused and we were able to get a better sense of what mattered to her.
We had to work really well as a team to get Mrs. Andrews back on an even keel. Clearly, lots of specialist expertise was needed, but each of the professionals ended up seeing her at different times. Our virtual ward round gave us an opportunity to discuss her case together, and agreed lines of communication allowed us to share thoughts between times. Each of us had to come back more than once over a few weeks to see how she changed with each intervention. The care home staff were pivotal. They were able to observe and get to know her in ways that we couldn't. They were able to work out practical strategies with advice from the dementia outreach and falls team. And, perhaps most importantly, they were able to advocate on her behalf to establish an advanced care plan that reflected her wishes.
Mrs. Andrews is much less muddled now. We have some great talks. On good days, she talks about her past with Arthur and the life that they'd had together. She's such a romantic. I think that by listening to her and telling her bits and pieces about my own life, it has helped her settle. She gets involved with the gardening and other activities in the home. We've even been able to talk with her about what she wants if she becomes unwell. She doesn't want to go back into hospital for sure. We got Dr. Smith in to talk about that, and she has done all the necessary paperwork. Now we can focus on the things that really matter.
You do go on sometimes, don't you? I think these lovely people have probably heard enough about me now. Why don't you make a cuppa and I'll tell you about that time Arthur and I went to Spain.
Right on it, Mrs. A.